It wasn't that long ago that if you needed surgery, having a transfusion was considered part of the operation. Today, patients from around the world are refusing transfusions on the grounds of medical concern and personal faith. They have found a much better option than accepting another person's blood. It's called patient blood management. Englewood Hospital and Medical Center has pioneered the use of state-of-the-art medical and surgical techniques which virtually eliminate the need for blood transfusions. It's a dramatic advancement in patient care, and it benefits nearly every single one of its patients, even those undergoing major medical and surgical procedures such as open heart surgery or cancer therapy. Since 1994, the Institute for Patient Blood Management and Bloodless Medicine and Surgery has led the medical world with its groundbreaking vision.
The blood management program initially got started at Englewood Hospital because we were approached by a group of patients who really were not receiving even standard care because of their refusal of blood transfusions.
Patients are quickly becoming their own best advocates when it comes to doing research and making informed decisions regarding their medical care. Many patients are realizing the benefits of a blood management strategy. They're choosing safer and more effective options than blood transfusions that are often risky and unnecessary. Here at Englewood, the data speaks for itself. Blood management techniques offer shorter hospital stays, faster recovery, less risk of complications, and fewer post-operative infections. Englewood became the first hospital in the country to offer patient blood management as a standard of care to all its patients. And those who refuse transfusion under all circumstances can be confident that their wishes will be documented, understood, and respected, whether expressed verbally or in writing.
The patient, in many ways, has to be recruited into decision-making, and that many patients find that very desirable. So it's a multi-modality approach, including the patient in many of the decisions that are being made, which I think brings you to a higher level of decision-making. It's not just the practitioner making the decisions alone.
Blood management techniques are possible in both elective and emergency situations. Careful planning and communication with your doctor can play a large role in the success of your surgery or medical procedure. Carefully researching blood management options and creating a written record of your decisions helps guide the doctor to honor your wishes if you can't communicate verbally for yourself, and gives the patient for whom blood is not an option clear and concise alternatives when making decisions on the techniques and technologies offered at Englewood Hospital. The purpose of this video is to assist patients in understanding some of the strategies, equipment, and products used in a blood management approach. Blood management is a wide-ranging, organized approach to medical and surgical health care. For example, common-sense techniques such as drawing smaller amounts of blood for testing, pre-operative iron enhancement, and precision surgery with minimal blood loss can significantly reduce or eliminate the need for blood transfusions. Individuals for whom blood transfusion is not an option are particularly interested in making informed decisions regarding two main categories of treatment options. Please consider the following descriptions of products and treatments and make note of areas where you may wish to do further research. Blood fractions are products made or extracted from blood components. Whole blood is made up of 4 components: red cells, white cells, platelets, and plasma. If you spin whole blood in a centrifuge in the lab, the red cells, white cells, and platelets sink to the bottom, leaving only a pale yellow fluid portion on top. This fluid is the plasma, and it consists of 90% water, proteins, clotting factors, and a tiny amount of other substances like salts, sugars, hormones, and vitamins. We'll now discuss some of these minor plasma-derived blood fractions and how they're used in some medications and products. Albumin is a protein made in the liver and extracted from the plasma. It can be given in emergency situations to expand blood volume. It works by moving fluid from the tissues into the bloodstream. It can be used as a volume expander to treat shock and severe burns. Immune globulins are plasma proteins which act as antibodies to infection. They can be used in some medicines that fight viruses and diseases such as tetanus and rabies, and can also be used in certain medical conditions that could endanger the life of an unborn baby. Clotting factors and tissue adhesives are substances in plasma that are vital to clotting blood. Each factor acts as one step in the process of clotting blood. Some are given to patients who tend to bleed easily. They can also be used in medical glues to seal wounds and to slow bleeding after surgery. Cryoprecipitate is a mix of plasma proteins and other substances that is also rich in certain clotting factors. It can control bleeding and is given in some emergency circumstances when bleeding cannot be controlled by other means. Stimulating factors accelerate blood cell production in the body's bone marrow. Perhaps the most well-known is erythropoietin, or EPO, which stimulates red blood cell production. Stimulating factors are now available as drugs synthetically produced in a lab, but a small amount of albumin is used in most of these medications to stabilize them. We'll now discuss some of the machines and procedures that actually utilize a patient's own blood. Some patients who will not accept blood transfusions may consider some of these options to be an extension of their own circulatory system, and any equipment is not primed with donor blood. Hemodilution is a process by which one or more units of the patient's own blood is removed in a closed system just prior to the start of surgery. The patient is then given fluids to keep his blood volume normal or above normal. Thus, blood that's lost during surgery contains fewer red blood cells. At the end of the operation, the withdrawn blood is slowly returned to the patient. Hemodialysis or hemofiltration is used when a patient's kidneys do not work properly. The patient's blood flows in a circuit through a machine that does the job of the kidneys and acts as a filter. The machine is not primed with blood, and the blood is constantly flowing. Known as the cell saver, intraoperative autologous blood salvage is a process where a patient's blood that is lost during surgery is collected, washed, and returned to the patient. The machine is not primed with blood, and Englewood Hospital, unlike many hospitals, uses a constantly flowing system. Postoperative blood salvage is a process where blood is collected from an operative site after surgery and returned to the patient. Blood remains in a closed system, and the equipment is not primed with blood. It is most commonly used in orthopedic surgery. The cardiopulmonary bypass machine, also called a heart-lung machine, does the job of the heart and lungs while the patient is having heart surgery. The patient's own blood is pumped outside the heart and body through the machine in a constantly linked system with the patient's own circulation. Blood tagging is a process by which a small amount of a patient's own blood is drawn into a tube and a benign radioactive substance is added to the removed blood. The blood is then returned to the patient, and the tagged blood is visually followed under radiological testing. For example, this technique can be used to detect internal bleeding. Every patient has specific and unique needs. This information just presented shows some of the common options used in many cases. The staff of Englewood's Institute for Patient Blood Management and Bloodless Medicine and Surgery can assist you with any specific questions you may have.
15 years have passed since we began the program, and it is amazing to me to see how far we have gone. We have become the center, I believe, of the education and training for physicians and allied personnel for managing blood conservation. I can tell you on a very personal basis, myself, I've had 2 major operations in my life, and each of them took about 6-7 hours. First one, I had 7 bottles of blood. Took me 9 months to get back to work. Second one, no blood. I was a bit anemic after surgery, but I was back to work within 8 weeks. That's not scientific. It's very personal and anecdotal, but for me, that is representative of what we can offer our patients.
I chose to come to Englewood Hospital because I was very concerned about not having any sort of blood transfusions. As one of Jehovah's Witnesses, I chose to come here even though it was much further than a lot of other hospitals in the area, but they have a wonderful Bloodless program. The doctors that are connected to Englewood Hospital are extremely respectful of our beliefs. They work closely with the Bloodless program, and they've always given us the support we need, high quality of care, and so I was very happy to take the time and to travel further to really receive that good quality care.
Today, nearly all surgery at Englewood Hospital is performed without blood transfusions. And patients who decline blood transfusions are sure to always have their wishes respected while under the care of Englewood. The outcomes are impressive. Patients at Englewood Hospital have lower complication and mortality rates than comparable patients in other institutions. Worldwide, patients and medical personnel are recognizing the important issue of patient autonomy. All patients have the right to be involved in making decisions regarding their own medical treatments. Bloodless surgery and blood management techniques have many benefits, including the physical safety of the patient and the emotional and conscientious needs of those who object to using blood. Many have been willing to travel long distances for medical care due to the shared vision between hospital and patients about blood management here at Englewood Hospital and Medical Center.